All right, welcome everybody. And I'm for some reason my seat feels like I feel like yikes. I need a taller chair. No, that's all right. We're going to hear from the prime sponsor of HB 1131. Welcome, prime sponsor. How are you? Good.
Good morning, committee members. So these two, actually the next two bills are mine. So we have HB 1131 and HB 1413. This one's going to have a little bit longer because they both kind of go together. In looking at mental health care and, the lack of it in our state, rather than just start brand new bills, it was good, I thought, to look at existing bills and see if there was any kind of a bottleneck within our system. And there were two glaring bottlenecks as far as being able to get people from that student status and having supervisors on to being able to continue to work. So 1131 is the first one, and this bill expands the person's exempted list to include organizations which provide clinical mental health services. Previously, so the original bills were back in early 1980, so RSA 330A34 is what we're amending. And what it said was it talked about that you had an institutional facility, nonprofit, but it wasn't really specific as far as a for-profit being able to have this exemption. And so what happens in real time and in real practice is that if somebody has been, you have to have a supervisor. You have this exemption to have the supervisor working with students. So while you're working for your practice and you are a student, you're an intern, you're able to see patients. You'll have, whatever, however many patients, 20 to 100 patients you could have up to. So what that led to before is as soon as you graduated without distinguishing that you could stay with a private practice that is able to have the students and stuff, you would have to actually leave there and go to a state institute while you're waiting on your full licensure, which can take a couple years. So you have this couple year grace period. So what we did was just explain this better to make sure that that it's fair for everybody, not only my brain just went, not only the nonprofits, but also the for-profits, because they do see quite a bit of patients. And also when you have 100 patients that have been going to a particular person and they're just waiting, they've done all their schooling, they're waiting for that next state to have their full license. If they're not able to continue practicing because this isn't specified, then you have 100 patients who don't have a continuum of care then. So this is just really kind of looking at this language. I would love to say a housekeeping bill, but we all know that those are the black hole of death. So anyway, just cleaning up the language. There was, what I thought was simple. We ED&A in the other house took a good look at it, and we came to an agreement on that would still do the same thing, but have a very clear language for everyone. So that way malpractice insurances too can look at this and go, okay, yes, you can continue to do this there. So I'm happy to take any questions.
Thank you for your testimony. Questions from the committee, please. We have to kill some time here. Oh.
I do a little tap dance.
Thank you. I have nobody else to speak on this bill. So.
Okay.
Thank you for your testimony.
Thank you very much.
And,
thank you.
You want to speak on this bill? On this bill? Come on in. Yeah. And introduce yourself.
Thank you, Representative Simon, Grafton District 1, representing Littleton, Lisbon, Lyman, Bath, Monroe, and Sugar Hill. I chaired the subcommittee that took a look into this bill, just making sure I have the right one and not the other one, which is coming up next.
1131.
Yep. So this was a situation where, because of the vagueness in the language in the original RSAs, it appeared to us once we looked into it that perhaps the board was inadvertently making a distinction that wasn't actually there. There was no definition for institution, no definition for facility, or anything like that. So it was our belief that they probably had the ability to do this all along. nobody seemed to be looking into it. If these public or private institutions had been allowed to do this, I'm not sure anybody was actually coming after them for doing that. As the previous representative said, we just cleaned up the language and made it very clear that they had the right to do this. It didn't seem like it was reasonable that one group would be able to provide these services and the other wasn't going to be able to. So I wasn't able to kill a tremendous amount of time for you, but that's what we looked at and that's what we came up
about 3
with.
minutes,
So
that's
yeah,
okay.
you know, like it's what I do what I can do to help.
All right.
So happy to take any questions if there are any.
See, questions, nothing. Thank you very much,
It's
Representative.
pretty simple. It should be
Yeah.
it should be an easy one.
Thank you very much.
Thank you. Yeah, exactly.
Okay, seeing how I have nobody else who wants to speak on this bill, we're going to close the hearing, and we've got a grace period, so if you want to take a lap around the building, help yourself, and we'll wait. to 1413 and hear from Representative Greg. Welcome back. Yeah, I know. It's all right. I'm capable.
Well, now that I'm nice and experienced, because this is my second time introducing a bill in the Senate,
easy.
I'll introduce myself. My name is Alicia Gregg. I represent Nashua Ward 7. So thank you for taking this testimony today and looking at this bill. So this is House Bill 1413. This one, same thing, kind of looking at those bottlenecks. What is stopping us from getting enough candidates, enough people through school so that we can provide adequate mental health care. One of the problems was in Section 330A22 of the old RSA, and what the problem in that is that on letter B in that it says the supervisor must assume both professional and legal responsibility in the agreement. In unfortunately, increasingly litigant society, we have a problem with saying that a supervisor would just be legally responsible for another adult without specifying that it's only in the workplace. So the amendment to this just says that the supervisor shall assume professional, ethical, and legal responsibility for mental health services provided by. So just clearing that up, because right now no supervisor looks at that and says, well, I want to be legally responsible when that person, leaves the place of business. So yes, once again, just kind of like cleaning this up, but really, really opening up the ability to get more supervisors agreeable to see students.
Right? That's it.
Any questions?
I don't know yet. Message from the committee. Seeing none. Well done.
We have enough time for coffee breaks
Yes,
today.
we
Thank
have
you
enough.
so much for your time.
Well done. All right. And James.
Hello, my name is James Klein, resident of Milford, New Hampshire. I'm also a forensic social worker, psychotherapist, and also a veteran of the Marine Corps and the Army, combat vet. I only bring that up, which I will in a minute or two, as to why I mentioned about being a veteran. So first thing is mental health board when it comes to supervision contracts. It's very difficult here in New Hampshire to define what responsive is. It could take anywhere from 2 weeks to 4 months for the mental health board to get back an approved supervision contract. Many states do not require those supervision contracts in place, which is why many of my colleagues have gone to other states to work. On top of the fact that here in the state of New Hampshire, the state schools are not very responsive to in-state students. They pride themselves on getting in out-of-state students. So even myself, I went out of state for my education. So the big picture is that ends up hurting the economy here in the state of New Hampshire. So if I've got to wait anywhere from 2 to 4 months to get my license and start accumulating hours through a supervision contract, guess what? I'm going to a state that's not here that I can start doing that. And the reason why I bring up being a combat vet is because a lot of the veterans out there want to work and talk to a veteran. That way, when they're in therapy, they don't have to stop and explain the acronyms and things that they're using. It's more of a peer situation. So the VA is very strict when it comes to requirements to hire social workers. You have to be licensed and or license eligible. And usually it says within 12 months. Well, if you got to wait 2 to 4 months, you can't start accumulating those hours, which can take up to 1.5 years, 2 years to accumulate those 3,000 hours. I know myself here in New Hampshire waiting for that supervision contract. It took almost 3 months. So I lost almost 500 hours of those 3,000 hours that I cannot get approved for towards my licensing. And that ends up hurting those individuals that are looking for therapy. So it takes the average person about 10 years to come forward to ask for help for therapy. So when they do, and they finally get that connection with a therapist, and then they have to put that on hold because that student is now graduated. Now they have to get a supervision contract in place. Now what needs to happen is they need to find somebody else, or the therapy gets put on hold. So some of those people might come back once that gets approved. Some of those people might not even seek therapy, and they can spiral out of control up to looking to take their own lives. I know this firsthand because I used to be the program manager for the crisis team down in Nashua for a couple of years. So this is real world stuff. So if you already got people that are struggling to come forward, it's going to make it much more difficult for them to come to ask for that help. Also, that ends up hurting the small businesses, especially the for-profit practices, because now they're trying to hire people, but they can't provide those services. They lose those billable hours that they could be charging, waiting for that contract to be in place. See what else here. Yeah, and again, it just really delays that recovery process for those individuals seeking out that therapy. And at the end of the day, I can only see this as a good thing for the state of New Hampshire, regardless of your political affiliation, because it helps out everyone that we're here to serve. Even as a social worker, I'm here to serve those individuals, just like everybody in the that's elected. They're here to serve the people of the state of New Hampshire. And I'd be well, answer any questions.
Well done.
Thank you.
Any questions? Saying none. Very efficient today. Good job.
Right. Thank you.
Thank you. I have nobody else who wants to speak on this. John, you want to come up here and say something? Just say hi. No? Good. All right. Thank you very much. And so we're going to close the hearing on 1413. And got another 10 minutes. So if you want to take another walk and burn some calories, go for it. I'm sponsor of 1330. Representative, you have the floor.
Good morning.
Good morning.
Mark Prue, Hillsborough 15, Manchester Ward 8. So I bring to you House Bill 1330. This started out for me kind of personal. Started basically with Section 5. My ex was on the disciplinary website, right, saying that she was in violation. She actually did a clerical error and they suspended her license. She passed away about 2 years after that, and we made a request to say, you think you can remove her name from that list? That would be really great. And they said, no, there is no way we can remove the list. There's nothing in law that says we can. I said, she passed away. She's not coming back for a job. And they still said no. I said, all right, well, then I'll put that in. And as I was doing this, I had a coworker and another friend who got caught up in a controversial call, right? She had to make a split-second decision, life-saving decision that maybe wasn't in the normal realm, but everything worked out. The baby lived. And most people who heard the circumstances said they would have done the same thing. The state took over 11 months to come up with a decision on whether she was going to keep her license or lose her license. And in those 11 months, didn't get much feedback on what was happening. And then you find out that the decision comes to one person who is not even an EMS person, is going to make a decision on EMS issues and doesn't have the background. So I said, there's got to be a better way to do this. And we came up with this. This is one draft, and then we amended it in criminal justice. And this is what we came up with that we thought would be a better plan, right? So we took one member from the Emergency Medical Trauma Services Coordinating Board, one member from the Medical Control Board, and the Medical Review Committee, right? We figured we'd make a panel of 3. They get the information that the investigator gives them. We set a timeline that they have 90 days, and then after 90 days, they have to reach out to that person and say, hey, we're doing your investigation. We're having some issues, whatever those issues are, and we hope to have it done by X, right? And then every 30 days after that, they need to inform them that, yes, we're still working on your thing, and this is what's happening. But at least that person knows something's happening and has an idea of where the investigation is, because, this is their livelihood, right? And they're feeding their children, paying their bills, and they want to know if they're going to be able to do that or not, right? So that's what we're looking at, and I hope you support it.
So you
Any
gotta
questions?
finish this story. Did she get her license back?
No,
She did.
she passed away before she got a license back.
The lady with the.
Oh, the lady and the baby?
Yeah.
She did.
Yeah,
Yep, she absolutely did, because she was right.
but it took 11 months.
Took 11 months. When everybody knew she should have got it back, it shouldn't have even been an issue,
Yeah.
to be honest with you. Because I heard the story and I
Saved a
said, I would have done the same thing. Because the ambulance was like 10 minutes away, there was a fire truck right there, the hospital was 3 minutes down the road. Put the baby in the fire truck
Sure.
while resuscitating it and save the baby.
Questions from the committee? No, not all. Wow. Well done. Good job.
Thank you.
Justin.
Good morning.
Welcome.
Thank you, Mr. Chairman, members of the committee. My name is Justin Cutting. I'm the Director of the Division of Fire Standards and Training and Emergency Medical Services within the Department of Safety. I'm here today because the Department of Safety opposes this bill as it's written currently. And briefly, some of those concerns are really technically based. The language of this bill does not repeal existing authorities granted to the Commissioner of Safety, which would create a conflict with the responsibilities given to this EMS disciplinary review panel. The bill does not grant authority to the panel for rulemaking. It doesn't authorize agency administrative support, which is has been done with some of the other EMS boards that Representative Prue mentioned. The emergency suspension language conflicts with RSA 541A in terms of the timeline. And there's a conflict with the authority relative to letters of concern. So I would like to note, as the representative pointed out, there is a process within current law and administrative rule where if a complaint is received, it's thoroughly investigated. Ultimately, a recommendation is brought to the Commissioner of Safety, who has the authority under current law to make that final decision.
So we have in question that 11-month period where somebody's hanging in limbo.
Yeah.
How do we get the Department of Bureaucracy that immediately comes to mind when I'm thinking about a situation like that, to expedite something like that? And my second part of the question, do you like the spirit of what he's trying to do?
So if I could answer them in reverse order, in terms of the spirit of what he's trying to do, we do not have a position. That's a policy decision for you all to make, and we respect that. With respect to the timeline, I myself have been a provider for 30 years. I understand the stress that that can put on those providers in addition to what they're already doing. We're aware of that. We work hard to make sure that we have a thorough process that follows the laws and the rules, and that we come to a factual finding. Some cases are complicated. There are oftentimes numerous complaints that are received with a lot of varying degrees of information. It requires, at times, weeks or a month or so to do the fact finding to narrow down the specificity of the complaint. It takes time we don't have subpoena power, so we work with the complainants and any potential witnesses to schedule interviews and take their testimony. All those things add up. So our average timeline is 6 months or less, but there are times that it takes longer.
So his deceased ex-wife, somehow she's not taken off the rolls or something. Is there a way to fix that?
There is. This portion of the legislation on that portion that he's talking about, again, we don't have a position. That's a policy decision.
Okay. Have you been able to chat with Representative Prue on this at all?
I have.
Okay. Any room for compromise?
Again, in terms of what he's trying to do, I respect the policy decision of the legislature to do that. Some of these technical components, I can absolutely share with him and work through those if that's what he would like.
I know as a vice chair of the committee, I would like to see something like that if at all possible. But are there any questions from the committee?
Yes, thank you, Senator Everett. Thanks, Director Cutting, for taking my question. And I just don't remember. So if you can refresh my memory on how complaints or concerns about EMS professionals come into the system. So it's a two-part question. So how do they come to you?
Okay.
Come to the Bureau of EMS.
Typically in written format.
Okay. Right. And so written format, do they have to be signed by a person or are they anonymous?
They can be anonymous.
They can be anonymous. Okay. So I'm just doing I'm
Oh,
just gonna,
that's fine.
yeah. And so they come in writing, they can be signed by someone or they can be anonymous. And then from there, do you make the decision whether, or the commissioner, who makes a decision whether this becomes an investigation or not?
I do.
Okay, you do. Okay. And then I think you've already elaborated on the time frame. Okay, thank you.
Further questions? Seeing none? Thank you for your
Thank you.
testimony. And if I could encourage you to basically, if we can hammer out some of these and get something,
I'm happy to fix all the things that he wants and remove the commission from the authority and give the authority to the board. I'm absolutely clear with that.
if you can come up with an amendment and work with,
But just so you know, they gave me word for word what they wanted, and when it came to criminal justice, I forgot.
can you come sit up? Yeah, just, yeah.
I'll slow down. So we had worked out a compromise, came to criminal justice, and I forgot who he sent, but when the chairman asked him if he was all set, he said, no, I need time to review it. And then my chairman asked me if I was all set with that, and I said, no, I really didn't like it. He said, well, go ahead and make it. I said, well, I didn't think I would get taken away the power from a police officer past criminal justice, but if you're behind me, I'll change it to what I really need to happen.
Well, if you folks can come up with an agreement and bring it before our committee, I think we can hold on to this for a little while. But
All right.
The sooner the better. I'd appreciate it.
Yep.
Thank you.
Thank
And-
you.
Thank you.
Yep.
And with that, we're going to close the hearing because I have nobody else to speak on this, and then we're going to hear from the real chairman. Was that?
Which vote are we on?
Finish 13:30, we have 3 minutes until 15:00.
Yeah, that's right. We're efficient over here.
Wow.
Yeah.
You are.
Yes, she's here.
I will open the hearing on House Bill 1598. Invite the prime sponsor, Representative Wallner. Welcome.
Thank you, Senator Birdsdale and members of the committee. In September, National Public Radio ran a story entitled, "Kids Get the Bill for Their Own Foster Care." Nationwide, 5% of children and youth in foster care qualify for Social Security disability or survivor's benefits. These children are children who themselves have a disability or their parent has died or has a disability. Across the nation, states have retained these benefits when a child is in foster care. But that is changing. Many states are moving to pass legislation to preserve the benefits for the foster child. Benefits are held for the child until they are no longer in foster care. The U.S. Department of Health and Human Services and the Social Security Administration have sent a letter to states encouraging them to make needed changes in this policy. The NPR Marshall Project found that 49 states, including New Hampshire, routinely retain a child's benefits, and the funds are used to reimburse the state for the cost of the foster care. States have an obligation to pay the cost of foster care under the state and federal law. So the existing policy of the state retaining the benefits means some of our neediest children pay for their own foster care. The proposed legislation would have had the Department of Health and Human Services establish an appropriate account to conserve the benefits until the youth leaves foster care. This could be life-changing for young people leaving foster care. They could now have resources to pay for housing, possibly continue their education, or buy a car so that they could get a job. We hear so often that many youth leaving foster care have no family to go back to and become homeless. During the deliberations in the House, the Department of Health and Human Services voiced many concerns about the administration of this policy. And the decision was made in the Finance Committee to provide the department, and this is what the amendment that you have before you, which the bill does now, it would provide the department with $150,000 to obtain a consultant that would help the department in developing this policy and how they would administer the policy. The report from the consultant would be due by December of 2024, so this year, so that we would have that information available as we're working next year on the budget. I'm open to questions. I do hope that the next person you call would be Dawson Hayes. He's here. He's a student here in Concord that I would like you very much to meet.
Thank you, Representative. Any questions from the committee? Senator Bradley.
So you appropriate 150K, but the fiscal note has 25 expenditure for 6 positions, 1.43 million, and doubling in the next 2 years.
Right.
Can you explain the difference?
Well, all of the fiscal note, that particular fiscal note is outdated at this point because the bill was amended to just be the consultant. And the consultant would then help us look at how much this would actually cost in the future. How would we set up, for instance, accounts to preserve those funds for the foster children as they and have them available to them as they aged out of foster care. So I think the department can speak to it, but that fiscal note is an old fiscal note.
Any other questions? Seeing none. Thank you,
Great.
Representative.
Thank you.
Dawson, come on down. Welcome.
Hello, and thank you for allowing me to speak today. I wanted to talk to you today about Social Security benefits paid to foster kids and what happens to that money. My name is Dawson Hayes, and I'm 16 years old. I was a part of the DCYF foster care system since I was removed from my parents' care in August of 2021 until I was adopted in February of this year. I've lived in several foster homes, and each time DCYF became payee of my Social Security money. These funds were granted by Social Security due to my biological parents' disability. According to the records I have received from Social Security, between August 2021 and February 2024, DCYF received a total of $16,132 on my behalf. Apparently, DCYF often becomes payee for the children in the foster care system. This is unfair because DCYF already receives government funding for the care they arrange for foster kids like me. I wonder why only the foster kids who are entitled to Social Security or veterans benefits are essentially forced to pay for their own foster care. When I asked my caseworker what happened to this money, she said it was to pay for the quote-unquote care and services I received. Again, this is despite the fact that DCYF already gets paid for my care, and I certainly did not receive $16,000 worth of extra care and services. This money should have been saved for my benefit. I would have invested it, which is what I have done with every penny I've received since. With some help and guidance from my adopted dad, I've learned about investing, and I have my own E-Trade account. In fact, I've made a 10% ROI from my E-Trade account. Imagine if I would have been able to invest that money. Foster kids need every advantage they can get, and this obviously includes the Social Security or veterans benefits that are intended for them. I did a little research, and I learned that in 2023, 1,142 kids were in the foster care system in the state of New Hampshire. Who knows how many of those kids had their Social Security benefits taken? I bet DCYF was the payee in most of those cases. I also learned that fewer than half of foster kids graduate high school, and only 3% get a college degree. In fact, 22% of foster youth experience homelessness at some point within their first year out of care. Considering these facts, it seems incredible that DCYF keeps any of that money, which could go a long way towards actually helping foster kids. Thank you for your time. I know I talk fast, so if anybody would like a copy of my statement, please let me know, and I am happy to answer questions now.
Thank you, Dawson. Any questions from the committee? My husband can use some of your expertise in the E-Trade thing.
Okay.
All right, thank you. See no questions. Thank you, Dawson.
Of course.
John Williams.
Chairman Birdsell, members of the Senate Health and Human Services Committee. For the record, I am John Williams. I'm the Director of Legislative Affairs for the New Hampshire Department of Health and Human Services, and with me today is...
My name is Laura Young. I'm litigation counsel for the Department of Health and Human Services.
And we are here in full support of Senate Bill 1598 as it was passed by the House. The bill sponsor, very thoughtfully brought forward legislation, and she, along with other advocates, worked with us very meaningfully to bring forward the bill to you that we're completely in support. So I don't think we have an awful lot to add from the testimony from Representative Wallner, nor from the commentary by Dawson. That was an incredible testimony, by the way. And it actually supports the need for the $150,000 appropriation for us to develop the roadmap to move this issue forward and to build it potentially into the budget for state fiscal years 26, 27. We're here in case you have any questions for us. Otherwise, this bill is a good bill, and we are here earnestly to making sure that a very thorough and thoughtful review of this matter and a plan to move forward on this important issue. I'm sorry, and I should ask Attorney Young, if you have anything you would like to add.
No, as usual, John has captured it.
So I have a question. Can we get Dawson back his money?
No.
Further questions? Can't, huh? No way of going back. Interesting. No further questions. Thank you very much. Megan. Welcome.
Good morning, everyone. My name is Megan Dillon. I am a non-attorney advocate with New Hampshire Legal Assistance and our Public Benefits Project co-director. I've worked with New Hampshire Legal Assistance for over 15 years and represented claimants like Dawson in their Social Security medical denial claims, adults and children, in both SSI and federal disability claims at the federal level. I'm in support of this bill and have worked closely with Representative Wallner, my colleague Michelle Wongren, who is the project co-director of our youth law project, and Karen Rosenberg of DRC, just to address just some of my personal concerns about what is happening right now is in representing firsthand children who receive these types of benefits, and the proposal for what it may be required to manage these types of benefits. As Dawson stated, the state does not have to be the representative payee for children in care. It's an election for them to do that. The onus of appointing and vetting appropriate representative payees lies with the Social Security agency. So in many of these instances, there may be a very appropriate representative payee available who has a vested emotional interest in this child's needs and care. That may not be the parent, may not be appropriate, but often there is a grandmother, a grandfather, an uncle, an aunt, a cousin, an adult sibling who could manage the benefits for these children. And under the Social Security POMS regulations, the state agency or welfare agency is not even the preferred rep payee. They're 6th or 7th on the list of the preferred payee to be considered for these children in care. And I would ask the state take a very close look at whether or not they need to be the rep payee, because they simply do not. And oftentimes there's a much more appropriate person to be the representative payee, which would take away a lot of these proposed fiscal costs to the agency in managing benefits for these children, the fiduciary responsibility and reporting for specifically SSI recipients, and could take all that away and have a very appropriate family member or other person managing these critical benefits for these children and saving the money whenever and wherever possible in an ABLE account, in a special needs trust, whatever may be most appropriate for these children. I'm hoping that this report will address some of those primary concerns about how they're handling these claims, because these benefits are critical. We see our clients come out of care with nothing, may have nothing, and these benefits could go a long way towards their education, their critical service needs, their critical medical costs. It's the regulations simply support that SSI specifically is supposed to be used for the best interest of the child, the best use of, and that's simply not happening right now.
Not to balance their budget.
Yes, exactly. Thank you for your time.
Questions?
Oh, I'm sorry.
No, that's okay. It's Megan, correct?
Yes.
Right. Thank you for taking my question. And you address the appropriate payee, just for clarification, so that it has to be a family member?
It does not have to be a family
Or
member.
you just listed,
Be a trust or something. You can follow up. Go ahead.
Yes, it does not have to be a family member. The Social Security regulations and their POMS regulations set out a table of preferred payees and a list. The first payees or preferred payees are typically a family member, yes, but it could be a friend, it could be a coach, it could be it's someone who has a vested interest in the child, as long as they meet the criteria for they meet the regulations as an appropriate person. You can't have a criminal record. You can't have certain charges, things like that. Other, civil legal claims against the person may prevent someone from being a rep payee. But other than that, if the person meets the criteria to be a representative payee as vetted by the agency, which is Social Security's responsibility, they can be the rep payee for that child.
Sure, thank you. So my next question, but now I have another one, was going to be if family member is inappropriate, who is? So, but you've already answered that question. Thank you.
Yes.
So it's in federal law?
Yes.
Okay, so if I'm hearing you correctly, is your position is that we can remove the state from this and just direct federal law towards the foster care family or so towards the payees that are in foster care?
The state does not have to be the representative payee. They are often choosing to become the representative payee for these children in care. When they could say to the federal agency, we are not going to elect to be the representative payee, please find an appropriate payee for this child. And that is Social Security's responsibility to do, not the state's.
What's to stop Social Security from doing the same thing?
From saying that the state has to be the representative payee?
No, from balancing their budget on something.
Oh, no, that would not happen. No, the agency cannot become the representative payee for the child. Yeah.
Or-
The federal agency cannot. Yeah. Yeah. They have to assign someone to be the representative
question?
payee for the
No,
child.
Thank you. So for clarity, your position is that this is all already taken care of, that the state could actually exit. We don't need that we wouldn't need a survey. Okay.
No, not
What-
that we wouldn't, that's not my position, not that we wouldn't need a report. My position in my statements are directed to the fact that as part of this inquiry, this report, I hope that they review the proposals that they're making about how much staff is required, how much more money this would cost, and how it would affect the agency if as part of that, they chose not to no longer become the representative payee for these children and allow Social Security to do its job and find an appropriate payee for this child who may have a vested emotional interest, which the state does not in these children.
So you support this amendment?
I do support this amendment.
you.
I'm just hoping that these considerations are made as part of this
I
report.
saw a little panic on John Williams'
No.
face back there. I just wanted clarity. Thank
No,
you very much.
I'm in full
Okay, sorry,
support.
John.
Thank you.
Further questions from the committee? Well done, and thank you very much.
Thank you.
Karen?
Good morning. I'm Karen Rosenberg. I'm the Policy Director at the Disability Rights Center, also here in support of 1598. What I am distributing to you is some testimony that a Manchester resident who served as a foster parent for some children she ultimately adopted sent to me because she couldn't figure out how to upload it onto the general court website. And I think what her testimony does, I won't read it to you because you can read it yourselves, but I think what it expresses is what predicament children are in when they're in the foster care system and have really significant needs related to their disabilities. So this person I know, Stacy Phillips, who's a Manchester resident, was foster parent for several foster children, two of whom she adopted. But several of whom had really significant disabilities and needs beyond what the foster care maintenance payments would cover for her children. And not being a wealthy person, but very committed to the welfare of the children that she fostered, Stacy ended up using her own money to purchase things like a specialized bed for one of the children that she ended up adopting when she was in foster care because her daughter would be self-injurious. She had night terrors and bang her head against the wall, so she needed a specialized bed with padding. She used her own money to send the kids to camp to get extra supervision. And my understanding was that she attempted to secure some additional funds. And even though her daughter was eligible for these funds, but she was never provided any additional funds. Another thing you'll read from Stacy is that she was a foster parent for another young boy who ended up being removed from her to go be with a sibling. Makes sense. She later reconnected with him after he had aged out of foster care. He was homeless. He reached out to her because among other things, he figured out that he was being charged with an overpayment for Social Security benefits that he never received. Apparently, he too was eligible for Social Security benefits. The state had been collecting those benefits, and somehow they fouled up the reporting, and so he was being chased for the overpayment. I mean, fortunately for him, Stacy had changed jobs and now works for the Social Security Administration, was able, with his permission, to resolve it. So he was a lucky young man. But it's so these are situations that happen, continue to happen. And one thing to keep in mind is that we're talking, especially when it comes to disability benefits that children receive, these are the lion's share of kids involved here. These children get SSI benefits because they have extraordinary needs resulting from their disability. It's very difficult for a child to be determined eligible for these benefits. Yet, in most instances, even though the Social Security Administration has determined they have extraordinary needs, our foster care system is not providing any additional services or funds to enable the child to meet those needs. So, our hope in this with this study is that the consultant will be able to look at how the state can maximize the federal benefits that we receive for these children to reduce the financial cost that this would put upon the state if they stop taking these federal benefits, and also look at how to best manage this in an efficient way, but also so that it's done in a way that enables children in foster care to have their extraordinary needs met and have the funds can serve for them appropriately so that when they are transitioning out into the world, they are not left with nothing and they don't end up homeless like this young man my friend Stacy encountered and fostered. I'm happy to take any questions.
Thank you for your testimony. Questions from the committee? Seeing none, you are our final speaker unless somebody else wants to speak on this. Going once, going twice. We're going to close the hearing. Thank you, sir. Ten o'clock, so we'll go on to the next one. As soon as you're ready, Cam. All right, so we're going to open up the hearing on 1669 FN and hear from Representative Leon. Welcome.
Welcome. Good morning, Mr. Chairman and members of the committee. For the record, my name is Erica Leon. I'm a representative for the town of Derry, and I'm vice chair of the Health and Human Services Committee. This bill does a couple things. The first thing it does is it deals with the fact that when we added the withdrawal mechanism to the immunization information system, we never actually gave the department the money they needed in order to make sure that when people withdraw from the registry, they're able to make sure that their information is taken out if it's shared with people in other states or other places. And if you're going to withdraw from our registry, that should happen with any interfaces that we have from our immunization information system. So I will take that as a newbie mistake of not appropriately funding our bills and making sure that we have all the supports that we need in order to make sure that they're actually implemented. So what this bill does is it makes it clear that prior to entering into an agreement to share that personally identifiable information with any other organization, like other state IISs, that the department will be able to ensure that withdrawals that are allowed under our law will be honored. This is not trying to reach into any medical providers' records, which we would not be able to do because under HIPAA, this information is kept for 7 years, but it basically keeps it out of any other information system. So what this does is, because they want to be prepared before they would enter into any contract, this establishes a position so that they can actually do this and make sure that our systems will be able to be compliant with this and honor the personal privacy of people of New Hampshire's immunization information if we get to a point where we share this with other states.
I have two amendments here. Are they all incorporated into this bill as well?
Sorry, two amendments. Are those Senate amendments or are those House amendments?
House Representatives is 127 and 0619.
Yes, both of those are included. When I had initially drafted the bill, I had also made it so that if somebody wanted to have the IIS share their information, that they could do that. But that actually would have been a $3 million cost in order to do something that that individual could already do. So I removed that in Amendment 619. 1747, I believe, is when we added in the position. That was in finance, so that we could make sure that they actually have the funding that they need in order to do this.
Fantastic. Thank you for your testimony. Questions from the committee? Seeing none. Well done.
Thank you very much.
All right, moving right along today. Anne Marie, would you like to come up and testify? And John.
And Chairman, or thank you very much. For the record, I'm John Williams. I'm the Legislative Director for the Department of Health and Human Services, and with me today is.
Good morning. I'm Anne Marie McCurry. I'm the Immunization Section Chief. Thank you, Senator Yabard and members of the committee.
Just to complement the testimony from Representative Leon, as with the last bill that you heard on 1598, this bill also has an outdated fiscal analysis on the bill. I will say, however, the fiscal analysis that is still on the bill is much more closer than it was on the last bill that you ended up hearing. So that's my only purpose being here today, other than to now turning it over to Ms. McCurry to present for the department.
Thank you, Ann. So we're just here to indicate that the department has issued written testimony. I'm here to speak a couple of points and then to provide information and answer any questions that you may have. As you may be aware, the New Hampshire immunization system is that secure HIPAA compliant system that allows for the connection and the really sharing of the immunization information for those participants who wish to share their information. So this is an extremely important effort for us to be able to start sharing with other states. It allows for more continuity of care for individuals who seek care outside of the state or who move into or out of the state, just really for that continuity of care to have a more comprehensive record. So this is something that we would like to be able to offer. We do not currently share any information with any other state at this time. This bill would make sure that if we were to proceed in that direction, we would not be able to share the information until the terms of the MOU were agreed upon with the other states to include the withdrawal as outlined in RSA 141C20. And also, we would also need to enhance those, the NHIAS system to really have the transactional logs so that we know where records went so that when an individual requests withdrawal, we are being able to fulfill their request by contacting that IAS directly to request the withdrawal. So we would need the funds and the resources to be able to do this work. And, just noting out that it is a voluntary system, so this would only be for those individuals who have voluntarily shared their information with the IAS. Thank you.
Well done. Questions from the committee? Senator Bradley.
Still, thank you very much. I'm still not clear because it's a voluntary opt-in system for the data registry, why there is going to be a cost to either upgrade the platform or to require more personnel. I'm not following that.
So we will have additional tasks because of this bill. We would not have just the information within our state system, which right now, if an individual has their information in, our staff is just able to withdraw it. It only impacts our system. This is really to connect other IASs to the information that is in our IAS when an individual receives care outside of the state. So we would need to have this reporting system so we knew where an individual's information went. So an individual would only have their information sent when they received care and it was prompted in another provider's record to try to get this information. So we don't have the systems to be able to know where a record was sent. So if it was sent to Massachusetts or Vermont, we would need to know that individual's record went there and to retrieve that from there. So it's additional steps, efforts, resources that would be needed to comply with this.
So,
and Senator Bradley, my understanding is this is a completely new task because we're currently self-contained in New Hampshire with this information, and we're not sharing with other states. Is a short, simple answer.
why are we potentially sharing information with other states? Excuse me.
Well, it improves continuity of care, and also since many healthcare systems are now regionally, it does mean that, there's limitations in what a provider would be able to access because they would not be able to review their own patients' medical records for immunizations.
And Senator Bradley, just for clarification, this is not a department requested bill. This was brought forward by Representative Leon, and it was her thought, and perhaps if she's still here to provide commentary, that she wanted to make sure that the same guards that are afforded to New Hampshire citizens for being able to withdraw from the registry, that would also be afforded in the event that the information were sent beyond our state borders.
Right, but maybe the question is better put to her. If it's a voluntary opt-in system for the parents, what is being thought here is that you can opt into the New Hampshire system, but you're asking taxpayer money to keep your information from going to other states? That seems ridiculous.
It would be to allow them to change their mind. So once their information is
Well, I
in
thought
there,
that was
this
so- I'm sorry to
withdrawals to
be-
change their mind.
I thought they already could change their mind.
They can change their mind in New Hampshire, but that would not withdraw a record in another state.
And our ability to allow that would require systems changes.
Look what you did, John.
If this bill dies, is this going to be a problem for the department? Because I've never heard of a more ridiculous expenditure
It,
in all the times I've sat here.
it would not have an impact on the department.
Okay.
We would strive
Because if
to,
you- Pardon me, but it would seem to me if you want to opt in, you opt in. If you don't want to opt in, you don't opt in. If you want to opt out, you opt out. All of that is current law now.
that is correct. And we would have the providers provide information that if their information was transmitted to another state, which they received care, we would direct that individual to contact that other
Which
state
makes
if they
sense.
wished for that withdrawal from that
If
other
you're going to
state.
Dana-Farber, it would make sense that you're,
Correct.
And Senator Bradley, as mentioned before, this was not department requested initiative. I just did my head scan in the room to see if Representative Land was here, just to give her the benefit and an opportunity to explaining in more detail. She was very open and working with the department on her legislation, but we do not, we acknowledge your concerns.
We got one.
I just want to follow up on, thank you, John and Anne Marie. So because we're different, we changed the law to be different from every other state. This is like a downstream problem that has popped up, and it's not, but Representative Leon wants to, because we don't participate in the same way, if a parent changes their mind, because of the way this is set up across the country, that's where the cost is incurred. Anne Marie is nodding yes.
That is correct. It's
Okay.
a very New Hampshire specific.
Thank you. You got it.
Senator Bradley.
all right. I know I'm being obnoxious here, and I apologize for that, but no, I don't apologize. Go. All right. So I guess my question is, if you opt in, does the parent know, or should they know somehow that information can be shared with out-of-state vendors before they opt in, so that they could opt out because they want to opt out because they don't want out-of-state information?
That is true. We are currently working on revising the administrative rules. And in the administrative rules, we have proposed the information that a provider should be sharing, and that would be included in that.
And
So-
Senator Bradley, I'm sorry, but you, just for clarification, this is all populations, not just children. It's the adult population as well maintained in our system.
Right, but it's just vaccines.
That is correct.
Well, thank you for your testimony. And with that, we have nobody else who wants to speak on this, so we're going to close the hearing on this. And thank you.
Was that the last bill?
You would have slapped me on the wrist for my behavior. Sorry.
I apologize for the Senate president.
You entertain a motion to exec?
Oh, good Lord. I will. Senator Avard
Well-
made the motion to go into exec. Should we just recess for 10 minutes? So
Okay.
we are going to recess for
I'll
10
withdraw
minutes.
my motion.
We will reconvene at
So my
10:30.
motion is hanging.
Maybe 11.
11.
We will recess until 11.
It is.
We will
All right.
recess until 11.
Gotta go get a yogurt. Motion to move into exec.
Second. All right, all those in favor of moving into exec, say aye.
Aye.
Opposed? Okay. We'll go in numerical order because that's what's easiest for Cam.
Okay.
So,
Don't want to mess with Cam.
question I had, the first bill I was looking at is 1093, the mask policies. There was an amendment. Did you take a look at 1093? Yes.
You need a motion?
Actually, yes.
A motion ought to pass?
A second for discussion purposes.
What's that? Yeah.
1093.
So I'm still waiting to hear back from a prime sponsor.
Okay.
So.
All right, so
It's meant to be a compromise.
we'll hold off on 1093
I
then,
remove my motion.
and as do I. Next up is 1131. And do I hear a motion of ought to pass?
Sure. So moved.
I'll second for discussion purposes.
Find it.
Any discussion?
11:30. Oh, thank you. Which one? 11:31.
Oh, this is the one we heard today.
Do you have a motion?
Yep.
Ought to pass, yes.
And it was
Second.
Okay, we'll let her second it. Any discussion?
I think this is a great step forward.
Yep.
All those in favor of ought to pass, say aye.
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 Opposed?
Consent?
Second.
All those in favor of consent, say aye.
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 Opposed? Okay.
I'll take it up.
Senator Avard? We'll take it up. $11.94, definition of non-communicable disease. Do I hear a motion of interim study? Okay, I'll, in a second.
Second, yes,
Thank you,
absolutely.
for discussion purposes. Any discussion?
This is the one. But the department came in. Yeah, yes, right, exception protects. Yeah. Thank you.
Are we all set?
Yes.
All those in favor of interim study, say aye.
Aye.
Opposed?
Consent.
Consent. All those in favor, we need a second. I'll second. All those in favor of consent, say aye.
Aye.
Opposed? Oh, Senator Whitley, you want to take this out? $12.31, permitting qualifying patients and designated caregivers to cultivate
I
cannabis.
move ought to pass.
Second. Okay, second,
What one?
1231. Any discussion?
So I've always been a bit torn on this. I think that some of the other bills that we're going to get to later have indicated that the price of medical marijuana is coming down, and by expanding the scope of what physicians can prescribe for, and the one that allows alternative growing sites, I think that price will continue to drop. As long as that's going the way it is, I cannot support 1231, I mean.
All right, so the motion is ought to pass. All those in favor of ought to pass, say aye.
Aye.
Opposed?
No.
No.
So
I move
Interim
ITL.
study.
well, we have two motions. One's interim study, one's ITL.
Well, he's older than me. Interim study. Yes, I'll second interim study.
All right. Any discussion? All those in favor of interim study, say aye.
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 Opposed?
No,
I'll take this out. $12.78, relative to qualifying medical conditions for purposes of
I
therapeutic.
move on to pass.
I'll s-
Senator Whitley moves on to pass. Senator Prentice seconds. Any discussion? All those in favor of ought to pass, say aye.
Aye.
Opposed?
Consent.
Second.
All those in favor of consent, say aye.
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 Opposed?
Give her a dagger.
All right. Senator Prentice, you want to take this out? $12.80, relative to informed consent and patients' rights.
Move on to pass.
Also is an interim study.
Okay. Interim study.
Second.
Senator Avard moves interim study. Senator Whitley seconds. Any discussion? Seeing none.
Cam, did we get a letter from Ben Bradley of the Hospital Association outlining how this bill, the intent of this bill is actually contained within the existing law and Patients' Bill of Rights? I had asked for that.
I haven't received anything in follow-up. We got an initial letter. I don't have anything in follow-up.
yeah,
So you, all right, so you want to hold on? There was?
There was? All right. So,
Do you have it? Oh, last night? Okay.
all I would ask is whoever takes the blurb out, assuming the letter is what I asked for, to make sure that parts of that letter go into the blurb, because the concern I have is, while I support the intent of what Representative Cushman is trying to do, if the AMA updates its ethics guidelines on Patient Bill of Rights, we're going to be required, if you will, to stay up with that, to always have to amend our law, which I just don't think is necessary, especially if our Patients' Bill of Rights now is consistent with those guidelines.
Do you want to hold off until everyone gets a chance to read that
We
letter?
could.
How does the committee?
I've only read the first one, so I'd like to read.
All right,
the
why don't
follow-up.
we,
I remove my my
And
motion.
I'm sorry, I didn't.
hey, can you make sure that the rest of the committee gets that letter? Okay. Okay.
Just want to bump it again, Kate?
I didn't see it.
Ben responded maybe the day after the hearing where you made that. Yeah.
Okay.
It's probably all right.
I'd rather,
There's so many.
wanna wait.
Yeah, it's okay.
yeah, and then I won't be here next week,
Yeah, I
so you guys can go, if you're comfortable with it, you guys can go ahead.
All right, which
All right.
number is it?
1300. Relative to terminal patients' right to
Wait a minute, I thought
triac.
you were going 1283.
I like this one.
Do you want to do 12A? Okay.
Which one?
I was gonna do 1283 last, just to make sure you still stuck.
Okay.
1283.
I move.
Well,
IT.
wait. There are two bills that we just mentioned. What are we doing?
We're doing 1283, not 1300.
I motion ITL.
Madam Chair, before there's a second to that motion, I have an amendment that I'd like to make, and I would like to make a motion for ought to pass and hopefully get a second so I could propose an amendment, a committee amendment, and you can decide what you want to do.
Sure.
Right. I just,
He has to withdraw his motion.
I mean, I can address this as a floor amendment as well.
No, you should, why don't you outline it now?
All right, I'll withdraw for now.
Thank you. And,
To make your motion.
Yeah, you need to make a motion
okay,
on the bill itself.
so I'd like to make a motion of ought to pass for 1283.
And I'll second your motion for purpose of discussion.
All right, so I'll speak to my motion, and then we'll introduce the committee amendment.
Well, introduce the amendment,
You
yeah.
want me to, for the purposes of introducing the amendment? So in talking with, so thank you for the opportunity, in talking with some of the different members of the healthcare community, as well as some of my constituents, a concern was raised about the prescribing provider determination that it maybe was not as tight as it should be, meaning, what was the relationship between the prescribing provider and the patient, that somebody could not, say, doctor shop. So my amendment would put in here that they have to have been examined, the individual in person within the past 12 months, obtained a history, and made a diagnosis as appropriate for that licensee's medical specialty. So it tightens up the provision around who's actually writing the prescription. That's what I wanted to propose. That's all.
Okay.
I'll second that.
All right, we have a committee amendment.
Senator Prentice, do you have actual language?
Do,
Okay.
coming.
Okay. All those in favor of the committee amendment, say aye.
Aye.
So, sorry.
Senator, this is a new section. 137M2. So this is on page 2, beginning. I'm sorry, page 3, beginning on line 14. I'm just trying to figure out where this goes if it gets adopted.
So page 2, starting on 27. And that's a big. And then
Okay.
B, that the consulting healthcare provider has.
So it's in those two places.
Right, so there's an A, confirm that the individual is either, and then B, that the consulting provider has. So the consulting provider would have to have an established relationship, examine that patient within the last 12 months. There were concerns raised that there were maybe assumptions made around that, so that's why I'm providing the clarifying language.
Appreciate it, Senator. Okay. All those in favor of the committee amendment, say aye.
Aye.
Opposed? Nay.
I'll move interim study.
All right. I'll second. Any discussion?
You can, I'm gonna vote against it, but I'm happy to speak to it, but I.
Go ahead.
prefer-
No, go right ahead.
First of all, I want to thank the chair for giving the opportunity to introduce that last minute amendment. I'm sorry I didn't speak to you ahead of time, but in the last half an hour, I've been on the fly. So that being said, thank you for the opportunity. I support, and I think it's been pretty clear all along that I've supported this, that 1283. I feel, there's like 3 primary areas that I work from within here. One is that the consent provision requires, and again, I live on the border of Vermont, we're practicing this in Vermont, and I have a healthcare community that's has adapted, and is actually, that we have prescribing providers that are right on the border, that have been speaking to me about their practice. So consent, 2 people, has to be witnessed, and only one of those can be a member, could be any relationship at all. They have to have within consent the mental, they have to have the capacity to demonstrate the understanding to make that decision for themselves. Nobody else can make the decision for them. That's reason number 1. Reason number 2 is that the diagnosis, I mean, and especially the way I see it, and I received a letter, and at some point, I don't know if today's appropriate, from an old friend of mine, Martha McLeod, about her husband's recent passing. And he had a diagnosis where it was within 6 months. They said, you have a very rare form of cancer. It's very aggressive. And this was not an option for him. And he died within weeks. So this would, as I heard it and have really tried to pay attention to some of the different, say, long-term neuromuscular conditions, neurological conditions, including, sadly, even some of our ALS patients, I don't think qualify for this. So I feel like the scope is very narrow. Then the last piece is that you have to administer it yourself. You have to be able to drink this slurry, smoothie, however it's mixed together. Nobody can give it to you. It's not given by IV. It's not given by pill. It's actually given to somebody as part of a smoothie. So that, again, nobody can give that to them. They actually have to be able to lift the hand and give that to themselves, which rules out, again, a number of the neuromuscular and, sadly, ALS, which is, I have a friend who's dying of ALS right now, and I had one who died 3 years ago, and this wouldn't be available to them. So I think the scope is narrow. I think the consent is tight, and the way that they would have to take the medication really restricts it to who it is. Nobody can give it to them. So that's, and again, is lastly, and I said this at the hearing, my experience as a paramedic, whether working in an emergency department or in an ambulance, has brought me in contact with some of these very difficult situations, especially when out in the field in someone's home where they had no other choice but to actually move that person into the healthcare system to get the care, to get additional pain medication or try to bring them some comfort as they were suffering from a really horrible terminal illness. Thank you very much for your consideration and your patience with me today. All right, I'm going to stop running around.
Any comments?
Okay. I will say off the bat, this is probably one of the most difficult issues I feel like I've dealt with as a senator, because it is so deeply personal to me on both sides of the issue. I was a disability rights lawyer. I have a sister-in-law with a disability. The concerns raised by the disability community are very important to me, and I listen to them very deeply. I think what we're dealing here with is sort of the fundamental and core value of bodily autonomy, and that is an issue, a core value of mine that is deeply important to me. And so it's sort of weighing those two issues. I do agree with Senator Prentice that the appropriate protections are in place. This is a narrow bill. This is a bill that has been considered after many years of, this being in place in other states. And I feel like it's narrowly tailored. I feel like the protections are in place. And so in the end, bodily autonomy and the dignity to make those decisions are weighing out for me.
I probably received more constituent mail on this issue than virtually any other issue. It's deeply personal. It's not black and white at all. Having actually watched family members who've been in the last throes of life and how it's be painful and difficult. I've been there. I had pretty much made up my mind before the hearing even started that I was not going to change my position, which has never been supportive of it in the past. The hearing only strengthened that in any sense. Having, watched family members be in hospice and get the kind of palliative care they had in some very difficult cancer situations, that there was pain, how it was dealt with. I think that the medical community has come a long way of helping people deal with pain. We need to make sure that, much as we vilified pain relief, OxyContin, and some of those options, that they are available to people in this kind of situation without recrimination or oversight by lawyers into doctors or politicians. We need absolutely to make sure that doctors have the ability to prescribe things like morphine when people are really in that kind of situation. What concerns me, and I agree with everything that you said, Senator Prentice, about it being a narrow bill, but I don't think it's going to stay a narrow bill. And the reason that I feel stronger about it than I did before the hearing is that the testimony of those people that were opposed to the bill made it pretty clear that you start here, but then it expands. And we've seen that with other things, many other things, quite frankly. And that would concern me. And so, having heard the disability community talking the way they've talked, I fear that the camel's nose under the tent becomes a lot bigger. And while there's certainly situations that are, very difficult, and again, it's not black or white, I think it tends to go in a direction that I would find pretty difficult to be able to support. So I can't support it.
Yeah, I would prefer to ITL it myself. And within the first few minutes of the testimony of those who brought the bill, convinced me right away. First of all, there was the objection to the fact that there will be no slippery slope. That was brought up. And then Representative Smith said at one point, there was very limited, to the point where she got some pushback as to why it's so limited, which led to the effect that there were people that wanted it to go further. The legislature changes every 2 years. I want to make it very clear that what I'm seeing on the campuses is disturbing. And they're the new leaders for tomorrow. And that causes me great pause, because the slippery slope is at our door. Our legislature changes every 2 years. And this opens the door. And I love you, Senator Prentice. But when you just brought up the cup, it really brought a big chill to me, because when I was a kid, I watched this movie called Soylent Green. And back then, the movie's theme was there was an overpopulation. And there was this elderly gentleman that had to go to this process where he's put into the room and they give him a cup. And he drinks the cup and he sees this beautiful panorama of what the earth used to look like. And of course, it was a way of him ending his life. And that really, I mean, I wasn't even 10 when I saw that, but it was chilling. I don't want to open this door for the government to say, okay, this is dignified. This is a death of dignity. Who determines what is dignity? Is it undignified to be suffering? I know suffering exists. It's around the world. It's been with us for a long, long time. But when we give the license for the government to say, this is okay, then there'll be professors who say, well, it's not dignity for people with Alzheimer's to be, or people with Down syndrome, or who determines what is dignity? And I'm afraid of going down that slippery slope because I think it's not, I know suffering happens. I'm not for suffering. However, once we open this door, history has shown people can abuse this power. I'm very frightened that this is something that could be abused. I would prefer an ITL. I'll go with interim study, provided I can keep it an interim study and give it a slow death. But I don't support this. And when Representative Smith said others wanted something a little bit more, that's the slippery slope that's banging at the door. That's what I feel. That's what I feel. So, and I feel that there are people who want it to go further, but they're halting. But there's people that want it to go further, and that to me says the slippery slope is right there, ready to come through that door.
Senator Avard, thank you. I appreciate your comments, and I respect them, and I respect you. The Cup, I remember that movie too. I just was distinguishing because people at the hearing made reference to handing a death pill to somebody, or the administration of a medication, maybe through an IV or through a shot. So I was distinguishing the way that this is currently done, but I do appreciate what you brought forward. So thank you.
Thank you.
And I can't support this. I mean, I agree with Senator Bradley and Senator
Avard.
Avard. What brought me, I didn't support it initially, but what brought realization to me is Lisa Bodwin's testimony. And when you talk about Senator Avard is absolutely right that there's already talk, and when Lisa Bodwin said, then Representative Wendy Chase testified at a hearing in 2020 on MAID that it could be expanded to include ALS, multiple sclerosis, and Alzheimer's disease. That scares me, that they're already thinking about what they can expand it to. So for those reasons, I can't support it. So. Ready for you? Any more comments, or are you ready for the vote? Cam, where are we?
Motion of interim study made by Senator Bradley, seconded by Senator Birdsall.
All right. All those in favor of interim study, say aye.
Aye.
Opposed?
No.
And Senator Avard will take that out. Next up is 1300, relative to Terminal Patients' Right to Try Act.
Move on to pass.
Second.
Any discussion? All those in favor of ought to pass, say aye.
Aye.
Opposed?
Second.
All right. All those in favor of consent, say aye.
Aye.
Oops.
Take it out. He's my constituent.
Hold on. Consent. Senator Whitley, would you like to take this out? Senator Prentice, have I given you one yet? Have I given you one yet? Okay. Yeah. All right. Next up. Next bill is 1318, relative to the duties of the opioid abatement advisory, and I will move ought to pass.
Second.
Any discussion? All right. All those in favor of ought to pass on 1318, say aye.
Aye.
Opposed? Second. Okay. All those in favor of consent, say aye.
Aye.
Opposed? Okay, I'll take this one out. $13.49.
I move ought to pass.
Okay. All right. Motion is ought to pass on 1349. Any discussion? All right. All those in favor of ought to pass, say aye.
Aye.
Oppose? Nay. Okay.
Was that?
I wasn't here. I was probably out on this
I'm
one.
just waiting for him to make a decision whether he is ought to pass or,
There are 3 ought to pass, 1
Yeah.
ITL, and 1 still thinking.
3 yays, 1 nay, and,
I'm a no.
all right. 3, 2.
I'll take that.
Okay, thank you.
That's the one I think you were.
Don't we have to wait?
Yeah, well, there,
1330, is that the one we're waiting on for?
1413 is one that we could do though.
but it also has an FN.
It does. So Senator Avard asked the prime sponsor and the Department of Safety to work immediately on an amendment.
And then,
So I think we should move it today, one way or the other. And
With the
they'll-
amendment?
and you get back to the prime sponsor and say he's got until next Tuesday to have an amendment.
well, can we do that one? Let's do that one last.
Okay, all right.
Because I have to go get, I have to get it. All right, so 1413.
I move out to pass.
That was one we heard today, apparently.
Yep.
I'll second for discussion purposes. Any discussion?
That makes sense.
All right. All those in favor of ought to pass on 1413, say aye.
Aye.
Opposed?
Consent.
Second.
All those in favor of consent, say aye.
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 Opposed? Avard?
I'll pick it up. Yep.
Okay. Um, 1568. Oh, this is the one that, it's not an FN, but Senator Prentice, I think this is the one that we were gonna do a committee amendment to replace all with your 409. Is everyone all right with that?
Yep.
Okay. So I guess I'll move ought
Second.
to pass, seconded by Senator Avard, and I'll move a committee amendment to replace all with 409.
Second.
Okay,
Senate Bill 409 as amended by the Senate.
correct. Good job, Cam.
What would we do out
I
without
know.
Pam?
All right,
Would we though?
All right, good.
where ought to pass, we need to pass the amendment.
Yes, the
All-
committee amendment has been moved and seconded.
Okay, all those in favor of the committee amendment, say aye.
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 Opposed? Ought to pass as amended. All those-
Second.
Okay. All those in favor, say aye.
Aye.
Opposed?
Consent.
Consent.
Second.
All those in favor of consent, say aye.
Aye.
And Senator Prentice, would you like to take this? What?
It can go up and- yeah, yeah.
1581, cultivation locations for alternative.
I move ought to pass.
1581.
1581.
15.
Yeah.
don't have it.
And I'm happy to speak, speak to the motion. And I just want to actually say something in general, that I learned more about therapeutic cannabis and really cannabis than I ever had known from some of the people that came and testified that,
this is
you
the
know,
one-
at that hearing. So I just, you know, that's one of the reasons that I support this. And I really have great respect for Dr. Knurk and what he had offered on all of these bills. So that's it.
This is for the ATCs to be able to cultivate, not for private, right?
Correct. I thought he really made the case.
This bill only applies to cultivation locations. It does not include dispensaries or facility where cannabis is concentrated and made into products.
This would allow outdoor cultivation within all of the context of the security that is required of indoor. Outdoor cultivation is less expensive. Again, that gets back to what I said before about the cost of medical marijuana being more consumer friendly. Therefore, I don't feel we need to move to home cultivation. So I think that's why I can support it.
Yeah, but as long as it's within that framework, I don't believe in doing that.
All those in favor of ought to pass on 1581, say aye.
Aye.
Opposed?
Consent?
Second. All those in favor of consent, say aye.
Aye.
Opposed? Senator Whitley, you want to take this?
Yep.
All right. Next one is 1598. That was one we heard today. I'll move on to pass.
Second?
This is the one with the Social Security payment.
Yep.
Yes.
Yes.
Thank you, Senator Burns. Yes.
All those in favor of ought to pass, say aye.
Aye.
Opposed?
Consent?
Second.
Okay. All those in favor of consent, say aye.
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 Opposed? And I'll take it out.
I appreciated how articulate Dawson was to speaking, you know, being like lived experience with the issue was great.
Um, 1604, relative to the use of electronic medical records.
Oh, Madam Chair, this is the one that there's a proposed amendment by Trish Tilley. It's in, Cam, if you look in the hearing report, she has a proposed amendment. Just to confirm or to confine the
Oh.
bill.
Yeah,
Yep, so in the hearing report, it would be adding, quote, notwithstanding any other provision of state or other jurisdictional law. And that would go on line 8 of the bill.
Do you have a motion yet?
EMS may mandate it.
So
Come on up.
what was the proposal again, Cam?
Anthem was a no.
So she testified adding, notwithstanding any other provision of state or other jurisdictional law.
Right here.
Okay.
And John
Yeah, you
Williams is here to discuss.
In a measure of being helpful, there were further discussions, and an amendment actually was worked out. Attorney Rob Berry from our agency, who's general counsel for the Division for Medicaid Services, reached out to the Department of Insurance and spoke with their legal counsel over there. So I understand there was another updated amendment beyond just that initial fix that we were looking for at the public hearing. If you could hold this over for a second, I can at least get you what the amendment number might have been, and apologies if that did not make its way to the committee and to Mr. Lapine.
I don't have it. Did anyone else get it?
Yeah, it actually moved the RSA placement of language from our statutes over to the insurance department, which resolved the department's issues around the bill.
Oh, okay.
All right. But that's
What was the number on the amendment?
It was managed care statute, which does not apply to us.
Do you have the number on the amendment, Sean?
That's what I was trying to very feverishly pull up on the system, and I can research that and get that to Mr. Lapine if he doesn't have it.
Was it did Representative Nagel send it in? Amend RSA 332I-14 as inserted by section 1 of the bill by replacing with the following: no public. That doesn't sound like
It's the
it.
only one I got. Yeah.
It was a 420.
Oh, okay.
I believe it's 420J should be the statutory chapter that you're looking for. I can research that if you could hold on this, and I can at least get back to the committee.
Well, it's an FN, so it needs to go out.
Understood. And if we can't be understood.
So Rob Berry did send an email to the committee adding the language to 420J8 as a new paragraph, Roman 19.
Perhaps a floor amendment?
What do you recommend?
We can do that. We can't do that as a committee amendment?
Yeah, we can do it.
So is what I'm hearing that the amendment that is coming to us, is out there in the is out there, is it would just change the placement of this, but not the content of it? Placement of the statute, this language in statute?
I would now turn it over to Mr. Lapine because he actually has the language in front of him. I do know that the placement was put into RSA 420J, so I am assured that you have the right language.
So the email from Rob Berry says, John Williams suggested I reach out to offer some language for a potential committee amendment to House Bill 1604. Rep. Nagel was amenable to the concept of an amendment that addressed the department's concerns that it may be unable to comply with other state statutes as the bill was currently worded. Subsequent to the hearing, DHHS spoke with Michelle Heaton of the insurance department, who suggested that the statute be removed from RSA 332I to RSA 420J. The placement of this language in RSA 420J ensures no conflict with any existing state or federal statutes from the department's perspective. And then he says, DHS suggests adding the below language to RSA 420J8 as new paragraph Roman 19. And it is the language contained on lines 8 through 15.
Perfect.
That's what I wanted to make sure.
Because
was in there.
May I? Because my understanding was the concern that the bill only be focused on EMRs rather than EMHRs, things like that, and that would address it if it's in the insurance or the managed care statute. Is that correct?
I'm not sure. I'm not sure if that's. I can't answer that. I'm sorry. I don't have the information.
But I do know that we're fine with the language that was provided that we worked on with the insurance department, and it does resolve our concern.
So what would be the impact of this language, notwithstanding any other provision, regardless of which chapters it cites?
Yeah. Our thought was originally that was a department requested fix, and if you have a default that you have to go to today, we would prefer at least some attempt, whether it is the amendment, I believe, proffered by Senator Prentice, go forward that we suggested. That would be particularly helpful, and certainly we could be engaged working with you folks as the bill makes its way further through the process. But this was a combined effort between our agency and the Department of Insurance to resolve our issue by taking the placement out of our statutes, which just resolve that conflict. It involved specifically if other state jurisdictions had different provisions of law, that this would allow us to accommodate for that, is my understanding. And I'm going to turn it back over to Ms. Rogers to see if that confirms her recollection as well.
Doesn't look like she wants.
I saw the squirrels going.
I was sort of halfway here in the hearing and then I had to leave, so I'm sorry, I don't have the answer to that, but I do understand that the clarifying language would meet the intent of having the bill move forward without any conflict.
How would this affect the the anthems, the pilgrims, our Harvard pilgrims and such?
Regrettably, we can't comment on the commercial insurance, but I would just say the language that Mr. Lapine referred to was worked on with Attorney Heaton from the Department of Insurance. And my understanding, it addressed, I shouldn't speak on their behalf, but my understanding is addressed their concerns.
So we don't have the language in front of us? still?
No, we don't. So,
I think we should ask Senator Gray to waive this, and it should stay here.
okay.
That's what I think. That might be convincing enough, Senator Gray.
I hope you do.
Because
It's not, it doesn't look
I-
like it's going to cost.
all the carriers have testified in opposition to it. It prohibits them from requiring electronic medical records. As I recall, the testimony was that some providers, maybe not doctors, not physician assistants, nurse practitioners, don't always have electronic medical records. So if there needs to be an exception for that, okay, I can understand that, but I'm not sure why we would be allowing, any of the other carriers, any of the other providers that are routinely covered under insurance from not having electronic medical records in this day and age. So I don't get the purpose of the bill. So until I can be assured of that, I would prefer an interim study or ITL motion, but.
Well, I think the whole concept behind, because a lot of the smaller organizations, like your chiropractors, your acupuncturists, they
massage
don't
therapists,
have.
and if that's a carve out just for them, I'm fine. But if it's a carve out for, what goes on in hospitals or doctors' offices, I'm not.
Well, so I agree with you, and I understood it the same way that there was, but so that this was for the smaller, more specialized practices who are currently required to do everything that, say, a large hospital with all this volume would do for a small group that they may have, and their plan may cover this procedure with insurance. So I thought the intent, but it is not clear, was that it was for that particular group, because the larger groups, the health systems, the hospitals, they're already doing this, and that shouldn't change. But we're trying to make a space for the people who have alternatives, and their insurance, their plans cover this care. That's what I understood from Representative Nagel.
That's what I do too, and I'm not sure this accomplishes.
It does, yeah.
And when you cite the Medicaid and managed care statutes, then I think it's really going in the wrong direction, actually, in terms of, allowing more and more practitioners to not have to use electronic medical.
So why don't we check and see if Senator Gray will waive it? We can push it out till next week, and that gives us time. Well, I won't be here next week, but oh, that's right. It gives the insurance companies time to review the language and see if it works for them.
If Senator Gray is waiving the FN, we actually have 2 weeks.
Woo. Oh, so you're saying you'll wait until I get back?
If Senator Gray waived the FN.
Okay. So why don't we? Yeah, that's right. We get back. So why don't we hold up?
There was no motion made.
Okay, good. So why don't we hold off?
And Chairman Birdsall, thank you so much. And I apologize, but I thought it would be important information to bring to this committee. And with the mantra from earlier today, this is not a department requested bill. But Ms. Rogers did have one other comment that she felt was important to relate to the committee.
Sure. Thank you. Thank you. As I remember from the hearing, the issue is that there may be a federal requirement that right that there's an electronic medical record. So the notwithstanding language just exempts the smoke providers from that.
If you got under meaningful use, was that? I think, so you
so.
talked about meaningful use.
Yes.
Okay.
Thank you.
Thank you.
All right, moving on. We're almost done. Next one is 1616.
Move on to pass.
Second. Any discussion?
Yeah, I'm concerned about this bill. I don't want, I mean, of course parental consent is very, very important, but I think this, and it is required already. Parental consent is already required for the provision of services in school that are covered by Medicaid. It's already required. So I believe that this bill is not necessary and could potentially cause some harm and interference with the provision of very important care in schools.
Okay.
Yes.
All right. Any other discussion? All right, the motion is ought to pass. Seconded. All those in favor of ought to pass, say aye.
Aye.
Opposed?
No. No.
Senator Avard will take it out. $16.60, I will move ought to pass.
Second.
Any,
So I would just say, I mean, there's another bill that's
Don't we
in
just do
a
16,
different
16?
committee that deals with the same subject matter, but is not just exclusive to Medicaid. Most likely 1660 would be not necessary when the other bill comes before us, and it could be tabled, and that would be my intent at that point.
Yeah, this is a bill that I cannot support. We're talking about potentially medically necessary care to save people's lives that are experiencing significant issues. I think there's that. And also, like, this clearly violates, non-discrimination provisions in the ACA, as well as current law. We did, in 2018, we added non-discrimination provisions in a bipartisan way, and we are going backwards with this bill.
any other discussion? All those in favor of ought to pass, say aye.
Aye.
Opposed?
No. No.
I will take this out. $16.69, relative to restricting data sharing through state immunization. This is the one that we heard today, correct?
I move interim study.
Second.
That's a bipartisan aspect. All right, any discussion? Seeing none. All those in favor of ITL, say aye.
Interim study.
Oh, I'm sorry.
I backed off being just totally bad.
They both start with that.
They do, and their S and T are close together. All those in favor of interim study, say aye.
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 Opposed?
Consent.
All those,
Second.
all those in favor of consent, say aye.
Aye.
Opposed? Okay. Senator Prentice, you want to take this out?
Sure.
Our last one. 1712. Renewing the committee to study non-pharmacological pharmacological treatment options for patients with chronic pain. I'll move on to pass.
Second.
We decided, the committee amendment, we decided not to do a 1712, but 12.
No.
Oh,
In the
so
hearing,
glad we
Senator
have him.
Bertzel, you asked if Rep. Nagel would be okay with if he thought the deadline to submit a report November 1st, 2024 was too tight,
that's right.
and you wanted to extend it.
I do. Would you be open to a committee amendment extending the report? Because so in section 6, it says the committee shall submit a report including its findings and any recommendations proposed legislation before November 1st. I had asked them to do, if they would be open to an interim report in 2024 and then a final report in 2025.
So moved.
I just like the bill.
Huh?
No, I'm for this.
You got that, Cam? Okay. I move committee amendment. All those in favor of the committee amendment, say aye.
Aye.
Opposed?
Move on to pass as amended.
Second. All those in favor of ought to pass as amended, say aye.
Aye.
Opposed?
Second.
All those in favor of consent, say aye.
Aye.
Opposed? And I'll take that out.
You want to do this one?
Oh, yeah, 1330. I'm sorry. I lied.
It's got an FN.
I think lie is the right.
Which one?
1330.
1330.
Right, this is the one that the sponsor has to negotiate with the Department of Safety.
Yeah.
So
This is the Senator.
I would move interim study with the hope that they can work it out. If they can't, I think interim
We
study
can do a
is
floor
appropriate.
amendment.
So who's going to communicate that to Representative? Okay.
Yeah.
Let him know that we're still open to passing it as if the amendment. Yeah. All right. All right. So second.
All right, I'm on the last one. All right, so who moved interim study?
I did.
Oh,
Senator
okay.
Bradley moved, Senator Avard seconded interim study, House Bill 1330.
All right, all those in favor of interim study, say aye.
Aye.
Opposed? And I suggest we don't put it on the consent, so we won't have to
Yeah,
pull it off.
exactly.
All right,
Want
so,
me to move
oh,
out of exec?
no, I'll take this out. All right. Senator Abar moved out of exec. I'll second. All those in favor say aye.
Aye.
Opposed? And I just want to say, Jessica, thank you for all your help in Health and Human Services. It's been a pleasure to have you. Sorry to see you go.
Thank you.
Well,
Takes it all back then.
I don't take it all back. We still appreciate it, and I'm glad to have you for a few more weeks. All right. Okay. We are done our business. I will adjourn Health and Human Services, and I hope you all have a good week. Senator Whitley and I will not be here next week.